Prader Willi syndrome is considered the most commonly known genetic disorder associated with childhood obesity. A great deal of research is being done, but to date there is no cure. It's a lifelong condition that occurs in about 1 to 15,000 live births and is characterized by a broad range of physical, cognitive, and behavioral defects. These include an abnormal body composition with excessive body fat and decreased lean mass, poor muscle strength, poor stamina, polyphagia or insatiable hunger, intellectual disability, and anxiety-driven behavioral outbursts. The presentation of these impairments is largely age-dependent. Body fat in these individuals can account for 40 to 50% of their body composition. That's 2 to 3 times higher than the general population. From birth onwards, fat mass continues to increase while muscle mass decreases. This significantly impacts on development throughout infancy, where motor or movement-related deficits are most prominent. These deficits include muscle weakness and feeding difficulties, which result in delayed development. This delayed development carries over into childhood, where many patients develop polyphagia, or excessive hunger, as well as cognitive, social, emotional, and behavioral deficits. Ritualistic behavior forms during this period, and angry outbursts when a routine is changed are common. Previous studies have found that children with PWS, or Prader Willi syndrome, are significantly less active compared to non-syndromic children. In conjunction with progressively decreased lean body mass, rapidly increasing appetite, and acquired routines of low activity, it appears that early childhood is a crucial stage in the course of the development of obesity. Obesity in children in recent decades poses a serious public health concern in all industrialized countries. The implications of this increase include an increased prevalence of heightened risk of disease, disease-related complications, and premature death during adulthood. Prevention is considered the most effective way to avoid obesity. So, what can you do to prevent your child's obesity? Early childhood intervention. Okay, so what can you do for your child? Physiotherapy aims to help people restore, maintain, and maximize their physical capabilities and overall well-being by addressing their underlying physical issues. So what can they do for your child? Well, 1, they can assess your child's conditions and needs. 2, work collaboratively with you to determine goals. And 3, develop a treatment plan or prevention plan that will try to suit your lifestyle and appeal to your child's interests. So how can their intervention help prevent the onset of obesity? Well, 1, they can provide general education about the impact of nutrition, physical activity, and sedentary behavior on developing obesity. They can redirect you to other health professionals such as a dietitian that can assist with managing and preventing obesity. And they can develop an exercise plan that attempts to suit your child's interests to promote maintenance of muscle, reduce increases in fat mass, and improve physical endurance. So, to sum up, why is an early intervention important? 1, well, the childhood is the period in which appetite increases rapidly. At the same time, due to the course of the condition, fat mass will continue to increase and muscle mass decrease. So without promoting good physical activity behavior, this change in body composition will continue and could increase the risk of decreased physical activity, poorer body composition, poorer fitness, decreased confidence, decreased motivation, poor health behaviors that continue into adulthood. So what can you do? Act now.